Primary health care is the most effective way to improve the health of the general population. It is also the most affordable and the most accessible.
The purpose of the primary health care center is to move closer to the community people and to help them, especially to improve on their health.
The health center is the last resort that every common person can access. It is affordable, it is at your doorsteps, it's not far from you.
Primary health care has been able to improve the health of our community member because it is very close to them. At any point in time, they have access to essential health care.
In Nigeria, about 70% of the population rely on primary health care facilities, making their quality crucial for the well-being of the nation.
That is not a true reflection of what happens, to be honest. I mean, I could ask you, have you ever been to a primary healthcare center? The answer is no. Do you know anybody who has been to a primary healthcare center in your immediate network? The answer is probably no. So but the chances are you have been ill, you have accessed healthcare in one form or another, and it has invariably been from the private healthcare sector. That is what we are seeing happens, because we know that 67 to 72% of healthcare accessed by Nigerians is from the private healthcare sector, of whatever type. And when we say private healthcare center, please don't think of just the 5-star marble and glass hospital edifices. Even going to the patent medicine vendor is accessing healthcare from a private health source. So I don't think that 70% figure that you put out is truly accurate.
If the data collection is flawed from the get-go, then the data that you derive from that community will be flawed. If the data we're deriving from our communities is flawed, then we're making decisions based on the wrong information. So we need to get back to the basics. It's extremely important that we invest in information technology and make sure that we're getting the right data from our primary health centers.
I feel more information have to be given, because some people doesn't even know primary centers is existing. Talk less of assessing it.
Millions of Nigerians rely on dedicated primary healthcare workers for quality healthcare. These unsung heroes stand at the forefront of the battle against diseases, delivering vital vaccinations, monitoring the health of mothers and children, and educating communities on preventative measures.
This here will take care of any ailments, anything with treatment. When they are sick, they should come. When they are pregnant, they should come down. We take care of them. When they are delivery, we take deliveries, take care of their baby, the newborn, the mother, even the sick adults and the children. So we'll keep on enlightening them, and they are coming.
And that way, the community can be champions of their own health. They can drive it, they can push it, they can make sure that it's sustained, they accept it as theirs, so that we're not spending so much on healthcare within the community, and also harnesses other sectors, including the environment, education, because these are all parts of primary health care.
They strive to provide care in the face of numerous obstacles, including limited resources, challenging terrain, and outbreaks of infectious diseases.
Negatively, that's the bottom line in a single word. So we're looking at this outbreak, for example, and let's just take the health sector aspect of it. Case detection, identification, and management. So they come, and they've had an episode of effortless diarrhea and vomiting and whatnot. Do we have the facilities to cope with such a patient? Do we have isolation facilities? Do we have the personal protective equipment that we need? Do we have the infusions, the giving sets, the consumables that we will need to keep such a patient alive? Assuming that we have determined that this patient is a little bit beyond our capacity. Do we have the transportation to move him to the next level of care. So these are immediate things that we are facing, quite apart from the fact that we now have to go backwards into the community. Where did the patient come from? Are there others in the home, in the family, in the community that are suffering this? How do we deal with all of that? Who's going to take notes on all of this?
Let them know what's the problem we have on ground, and they can prevent before it's now turned to outbreak.
It makes the work to be more, because more people will come in. But we also arrange ourselves then so that the flow will go smoothly, so that at least there will not be too much rushing. And we also do triage, so that we now observe our patients, we check them, the one that need urgent care. So that's how we triage our patients.
One of the biggest challenges primary healthcare workers face is the sheer volume of patients they see. The ratio of healthcare workers to patients is extremely high, making it difficult to provide adequate care to everyone.
The challenges we face is, number one, infrastructure, then some of the commodities, the consumables that we are supposed to use, they are not enough. Not that they didn't provide, but most of the time it is not enough compared to the client flow or what they are here for.
We are not problem-free, but ability to manage it is one.
They struggle to cope with the high patient loads and limited infrastructure.
Ordinary Nigerian like us at the street can always walk in, that is close, at the vicinity where you live. We can always walk in and, get yourself checked or receive some treatment, before you can then transfer to a bigger hospital or where you don't have such money to attend, those big hospitals. I think they are doing quite well, and it's very encouraging, to have them around, even to bring more.
Anything public is always congested because a lot of people want to utilize that free facilities and all. So in terms of emergency, when you have emergency, I think they need to improve on that, because it's always very choked, and that disturbs some more intensive cases, health cases, for them to attend to. But overall, if only they can just contain the crowd, all right, I think it will be better.
The experience we are having in hospitals now is that everything is very costly. Most people cannot afford their own personal treatment. And the government hospital, they are even worse than private hospitals. When you go there, you buy a card, you do tests. And most people that go to general, they don't have that money to run most of the tests. At the end, most of them die before they even gather money for their treatment.
You can see people are dying. It's not because they have serious issues, but little headache, when you go to the hospital, they will charge a lot. People don't have it. That's why you see people dying every day. It's not that because of any other thing. If the prices of medical services are brought down drastically, people will access the hospital for their medical needs. But because of finance, they can't.
There have been calls for more investment in Nigeria's primary healthcare system, including training more healthcare workers, improving infrastructure, and ensuring a consistent supply of medical essentials and crucial steps.
Because you've got to think of the Nigerian healthcare system, and in fact any system, in a continuum. So you've got people coming into this system. They've been coming in for the past 60 years and hopefully will continue to come in for the next 60 years. You've got to have people to train the next generation of healthcare workers. How many teachers do we have left? Because we have not incentivized our teachers to stay in the system. And that's the problem that we're having. We have lost, and this is going across board. You can think of the physicians, you've got the nurses, physiotherapists, pharmacists, medical lab scientists. Who is teaching them? How do we get that quality of teaching back that ensures that we have the next generation of healthcare workers.
The path to a robust primary healthcare system in Nigeria requires collaboration, investment, and a commitment to listening to those on the front lines.
But we keep on enlightening the people, because there are still some of them that still believe in going to these the quacks. So keep on enlightening them. I think that's what we, for enlightenment, motivation, we motivate them, campaigns to preach that they should come down to PACs, health centers.
There's no point reinventing the wheel every single time we have a new administration. Let's implement the policies that we already have. Let's invest in primary health care. Our healthcare spending to GDP needs to be pushed from the 3% to GDP to at least 15% to GDP.
The first and most important thing that needs to be done is we need to staff the primary healthcare sector. We cannot have a health sector without staff.
From the bustling cities to remote villages, the voices from the front lines of primary healthcare in Nigeria echo a common message: resilience, dedication, and hope.
For me, I love to be a nurse. That's why I choose. And I will do all to make sure I do my best, try my best, and ensure that the patient, they have the quality care and they're happy too before leaving.
As a nurse, I have passion for nursing and caring for people, no matter what. So that is what motivates me. They should know that we are the health center because of the community. So, and they should know that we, the health workers, we are caring, we are loving people to attend to them, and we are here to see to their welfare. So they should not look at us as if, because some of them will say health workers are wicked, they are not patients. We are patients too. But you know, most of the time, when we have less health worker and more flow, there is no harm. We too, we are human beings, but we try to at least accommodate them.
Primary health care workers are readily available for them. We are readily available for them anytime, any day they need us. They should call on us.
So I want to employ people to see us as the first place of contact before going anywhere. Private hospital is there, they are not cheap, and we have affordable drugs there.
These stories point to the power of community and the importance of accessible healthcare for all.
Political will is very, very important. If our leaders don't understand the value of PHC, primary health care, they won't be incentivized or even inspired to drive it. So political will is extremely important. We can see how PHCs have grown and waned, and we've seen it happen with successive administrations, depending on how important it was considered by the current administration.
Together, we can build a healthier future for Nigeria.